Now, when I receive instructions that a patient would need IV cannulation, I would go to the clinic room, and normally what I prepare would be saline, extension set, IV cannula. I normally use 22 gauge, tegaderm film, and alcohol swab plus my tourniquet. So before I go to the patient, I will always prepare the items. Just to ensure that everything is out of its packet and ready to go, rather than having to do all this at the patient's bedside. We also use 2 tegaderm films just to ensure that the line is really secure. I even go as far as preparing the alcohol swab. I will then take this to the patient's bedside with a pair of gloves, alcohol swab, and sharps container. So now I arrive at the patient's bedside and I use the alcohol to sterilize the hands, wait for about 30 seconds for it to dry, and then I normally use non-sterile gloves. Now, there are many veins of choice for this procedure, but what I always make sure is that nobody cannulates the inner aspect of the wrist. So we normally steer clear, completely clear of this particular area because of the hazards of going in there. So we normally go for one of the dorsal veins. So I apply the tourniquet about 4 inches above the site of insertion. Just give the area a little bit of a tap, a nice little bouncy vein. I apply the alcohol and ensure that I do not touch the site again before insertion after the alcohol. I wait for the alcohol to dry, which takes about maybe 20-25 seconds. I can see that it's dry now. I just ensure that the cannula is functioning properly. And I go in at an angle which is about 20 degree angle. So I go in. You can see immediately I have flashback. I hold the stylet. I push forward the sheath, undo. And at this stage, I apply the first tegaderm. I remove the outer. Now I will flush the extension set to ensure that we don't introduce any air embolism. I will remove the stylet, putting pressure on my third finger, which is the tip of the catheter. I dispose of the stylet into the sharps container, screw on the extension set, apply the second dressing. To ensure that the cannula is in the proper position and it's still in the blood vessel, I attach my syringe to the end of the extension set, draw back very, very slowly, and I see I have total blood return. So I flush the cannula with a couple of mils, maybe 5 mils of saline. I check again just to ensure that everything is in place. Everything is 100%. Cannula is in place. Patient is happy. And we move on to the next patient. Dispose of all the sharps, clean my tray, and dispose of gloves, wash the hands, and move on to the next patient.